Let's get more on this from the President's Chief Medical Advisor, Dr. Anthony Fauci. Welcome back, Dr. Fauci. Let's pick up on that encouraging news on the vaccines. The supply is going to be increasing over the summer, but we're still facing some bottlenecks across the country. How do we accelerate distribution, break through those bottlenecks?
Well, George, there are a few things that the president has put into the strategic plan. One you just heard reported by the correspondent, namely getting vaccines into pharmacies where people can conveniently get vaccinated. The other is the standing up of at least 100 vaccine centers, community vaccine centers. And the other is to use mobile units to get into not easily accessible areas. So those are just three of the things, as you say, to kind of loosen up the bottleneck of getting the doses into the arms of individuals. You've heard right now we have contracted for a total of 600 million, which would be just enough and maybe even a little bit more to vaccinate everyone with 2 doses. And
you've had some hopeful words. You say it's going to be open season for vaccinations by April. Explain what that means.
Yeah. Well, George, when the Advisory Committee on Immunization Practices made the recommendations of the priority of vaccinations, have all the doses you need at the same time. We started off with healthcare providers, people in nursing homes. Then we went to essential members of society together with others, for example, who are elderly, and then others who have underlying conditions. Once you get past the priorities, then you can essentially say anybody who's anybody can just get vaccinated. I refer to that sort of to make people understand it as open season. No matter who you are, you can get a vaccine. And when you have enough vaccines to do that, then you're going to see a great surge in the number of people who get vaccinated. And that's what's going to happen as we go from April to May to June. And then hopefully by July, we'll be at that point where we have enough vaccine for virtually everyone.
We're expecting to see the CDC guidelines on reopening schools today. What should parents know about whether it's safe to reopen schools? What should give them confidence that it's okay?
You know, what I think it's going to be a combination of things. I don't want to get ahead of the guidelines that the CDC will be coming out with imminently, but obviously you want to get the schools open. The president has said that he wants to get essentially 100% of the K-8s open in the first 100 days. I think that's doable. What you want to do is make sure it's safe for the students and safe for the teachers and other personnel associated with the educational system. You can do that by masking. You can do that by getting good ventilation, but you could also get that by getting vaccinations to the teachers as quickly as you possibly can. As
cases and hospitalizations and death come down, we're seeing states, more and more states and cities relaxing their lockdowns. Montana dropping the mask mandate. Here in New York, they're allowing indoor dining again, preparing to have sports venues open again, concerts as well. Ohio's lifted its curfew. Is it safe to relax these lockdowns now?
You know, if you do it gradually, George, without like turning a light switch on and off. Remember, we had that conversation months and months ago when we were trying to open up America again for the economic reasons. You want to do it gradually and safely, as opposed to just turning it on and off right away. There's still going to be the important need to wear masks. I think we still need to do that. You want to avoid congregate settings, but you can gradually get to the situation where you might open up restaurants with limited seating and things like that. But it's got to be done prudently and gradually.
And when you say need for masks, you mean for quite some time, into the foreseeable future, year, 2 years, 3 years?
I'm not so sure it's measured in years, George, but I think until we get the level of virus to such a low level in the community, and I had said a projection, and it's only a projection, that hopefully by the time we get all the people vaccinated, let's say 70 to 85% of the people vaccinated, the level of virus in the community could be so low that you could start pulling back a bit on what are stringent public health measures. You don't want to do it all at once, but I think we're going to be wearing masks for several months into the future.
Dr. Fauci, thanks again for your time and your information.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.